Hi everyone, I'm Miranda,
And I'm Lauren.
and we're occupational therapy students at the University of Cincinnati. We were talking about prematurity and we had a lot of questions, so we just wanted to answer the questions that we had. So, Lauren?
So, to begin with, we found a statistic that said 13 million infants a year are actually born premature, and it's responsible for 1 million neonatal deaths annually, which we both thought was a pretty large amount.
That is a really large amount. So, when exactly is a baby considered premature?
Okay, so typical term for pregnancy is 39 weeks, but for a baby to be considered premature, they're born before 37 weeks. And we found this diaper from the NICU unit for premature babies, and look how little it is compared to a typical size diaper. So we thought this kind of defined how much of an impact premature birth has, because you can fit this in your hand. So just to give you guys a little visual. Okay, so when a baby is born premature, what is it developed yet?
So, there's a lot that isn't developed yet. From week 27 to 30, we still have the brain and nervous system growing. So, then from weeks 31 to 34, we still have the lungs that aren't fully mature, the bones are still soft, and the muscles and bones are not fully developed. So, it's a lot that isn't quite developed yet. And yeah. So, what are the causes of premature death? What causes this?
Okay, so there are actually a ton of causes that we found. I'll just go over a few. And so there's really no one cause, but there's a lot of factors. So preeclampsia, which is high blood pressure in pregnancy, having multiple babies such as twins, triplets, smoking cigarettes, using drugs, infection, chronic conditions if the mom has high blood sugar, physical injury during pregnancy. Sometimes premature birth is induced if they think the intrauterine environment isn't healthy. So there's just a bunch of factors that kind of play into it. So what are the complications of premature birth?
Well, whenever we talked about what's not developed yet, we found out that the lungs aren't fully developed yet if it's between that 27 and 31 week mark. So they may have breathing problems, and that's due to an immature respiratory system. They may have immune system problems because they have an underdeveloped immune system. This can increase the risk of infection, so you have to be really careful around little babies. They may have difficulties regulating their temperature. We said that their nervous system may not be fully developed yet, so that's one cause of that. They may have gastrointestinal problems, so the infants are unable to coordinate the suck and then swallow before 35 weeks of gestation, and they also have poor digestion, and that's definitely a complication. There's also developmental delay and then vision and hearing problems within that developmental delay that may affect their ability to function in their everyday lives. So that kind of leads us to talking about what's the role of occupational therapy with premature infants.
Okay, so since we're OT students, we were really interested in what our role was for future. And our role as OTs is to educate the family, encourage optimal development. So choosing appropriate occupations, sensory motor processes, neurobehavioral organization. The Division of Occupational Therapy and Physical Therapy, we provide oral motor, feeding and development evals and treatments, safety of oral feeding, feeding techniques. We have a medical team to establish feeding schedule. We have intervention that includes hands-on treatment to influence muscle tone and movement. So we have a pretty important role as the baby transitions from the hospital to home.
Okay.
So how do we prevent premature birth?
Well, good thing technology is on the advancement side, so there's a lot more babies that are surviving despite being born early. But prenatal care is a key factor. The mom has to make sure that she's having a healthy diet, has to make sure that she's at a good weight for her baby. prenatal visits to check on the health of the mom and the baby is definitely important, and the practitioner does a job in identifying the problems and lifestyles that may increase risk, and also education. So education is key. What exactly is the importance of, why are we talking about prematurity, basically?
So it's an important issue because premature birth happens 1 out of 10 births. So there's many factors that the mom can do to help prevent this. So I think it's an important topic to discuss because there's a lot of prevention that can be involved, and how to best facilitate positive outcomes through premature birth.
Well,
Go ahead.
I was gonna say that's all the questions that we have for today. Did
Yeah,
you have
nope,
some
that
thoughts
was
to add?
it.
Okay.
No.
Well, that's all the questions that we had for today. We encourage you to
Check out more information on prematurity, and that concludes our Q&A.
Yeah, ready? We're gonna roll out. Can we roll out?
Yeah.
Yeah.
Okay.
And we're